emergency veterinary medicine. Welcome to the first episode, and it's going to be the dreaded hyperkalemia. So you get a block cat that comes in on triage, you run your blood work, and the potassium is above 8.8, let's say, and then ionized calcium is 0.67. So before you even think of setting up your unblocking tray, you can ask someone else to do that. Your absolute priority is cardiac stabilization. So the first step is to protect the heart. How do we do that? We give calcium gluconate. So we give 10% calcium gluconate. The dose is 0.5 to 1.5 mil per kg IV, slow over 10 to 20 minutes while you monitor with an ECG. The key point to remember is that calcium gluconate does not lower serum potassium. What it does is that antagonizes the hyperkalemia effect on the cardiac cell membrane. And what you need to do is that it returns to the normal threshold potential. It buys you 20 minutes to an hour, let's say, a very critical time that we need to lower the potassium. So then what we need to do is start lowering our potassium. How do we do that? There's multiple ways. The first line is to start using regular insulin and dextrose. So what it does is that it activates the sodium potassium ATPase, and it activates that pump. So the standard dosing is regular insulin. It's 0.25 to 0.5 units per kg IV. And then you also have to give dextrose. Now, if your patient has a huge stress hyperglycemia, you can hold initially and titrate the dextrose. But I personally always give it because I'm always worried. And then I also start on a CRI. Then Terbutaline, a beta-2 agonist. You can also do that to stimulate sodium potassium pump and activates the intracellular shifting. Sodium bicarbonate also reverses a severe metabolic acidosis. So it's 1 to 2 milliequivalents per kg IV, also slow over 10 to 15 minutes. And what that does is that it shifts the potassium into the cells. You have to use caution because it can temporarily lower the ionized calcium further. Then you want to use your unblocking. So temporarily you can do basically a relief cysto. I really like those. And you're putting your cat on fluids because you want to help that renal perfusion. You can then start getting all your stuff together, setting up and unblocking the cat. I know it's scary always when there's really high potassium, but there's so many things we can do. Our primary concern is to protect that heart and to give the calcium gluconate and to give the insulin and dextrose, and then go and unblock your cat.